Welcome back, chameleons, to Aspie Answers as your host, Aspie Answers. For those of you who are new to my podcast today, I welcome you all, and I'm hoping that you'll get to know me more of a person behind the mic, as well as the diagnosis of autism and mental health. Just a brief little intro about me for those of you who are new today. I'm Aspie Answers, as I said quickly. I'm all about creating mental health videos as well as autism videos, taking you all on a journey when I'm able, as well as advocating, navigating through life through autism and mental health, as well as educating you all and so much more.
I would like to put
3
disclaimers on right now as I'm doing this podcast. Number one is I'm not a medical doctor. I'm just your normal Joe blog sharing my lived experiences with Aspies syndrome, or Aspies in short. That some things I may share, how I cope on the daily, may or may not work for you, and what may or may not work for you will not work for me, or vice versa. What works for me will work for you. Hearsay. And in saying this, that if there's any signs and symptoms that presents to the cases of what I share of these everyday topics of mental health and autism, do seek professional advice and second opinion, as well as also just in saying that I don't wish to see any harm in the making. The second part of the disclaimer here I would like to discuss is, as I go along sharing you with the podcast of the topics, the terms I'll be using, like Aspies and autism, will likely to interchange a bit throughout the series, and I don't want to offend anyone. This will go for the terminologies of people with autism, persons with autism.
This again will depend on the person who has autism, of the actual how they want to be addressed as an autistic or a person with autism. So be respectable when you do meet an autistic, hearsay, because obviously at the end of the day we don't want to, like I said, offend anyone, and in saying this, that of this offence we should be able to just remove our mentality and just be respectable of others' opinions, beliefs and what have you, because at the end of the day everyone's different. Ask an autistic first before maybe addressing them as an autistic person or what have you. Just get to know them as a person as a whole behind the autism, as well as removing that kind of wishful thinking that everyone is the same
or what have you, but more of that of the case how to address the autistic community and the executive functioning labels or what have you that I will be presenting in one of the series over. Since I'm an autistic, don't forever assume that, you know, as you're getting to know me as a person behind the voice or behind the actual camera, that every autistic is the same. Every autistic will be different, because obviously autism is a wide spectrum of different kind of conditions that branches out, but I'll be sharing more about autism, what it's like later on in one of my podcasting pieces.
The topics that are being shared right now as I'm sharing with you all today will obviously be based on an American, UK or Aussie website or any other websites as I do my research, because as I said before, that many of these research findings that I'm doing right now will be based on this areas, because New Zealand has limited resources and references to what I'm sharing with you all on the everyday topics that you may be questioning on and want to learn from me, based on also my lived experiences as well. And in saying this, while I give you some tips and advice along the way, please be considerate inside the actual advice part of it, as this is just strictly based on my lived experiences. As I said, some of this may work for you versus vice versa may not work for you as well, so let's just be respectable of each other's differences of opinions here.
Right now I'm talking about, as you can see, titled for this episode, it's going to be clinically all about autism and Aspies syndrome. As you're aware, basically, as we're continuing on, that this term that I'm using right now of autism and Aspies syndrome, or shall we say basically Aspies syndrome, as I mentioned in one of my videos, which you can see, Aspies syndrome is no longer a diagnosis, which will clearly be shared with you guys in my podcast in this series, just to follow on, so that you can have the choice to either watch it live on my channel or versus inside here on my podcast.
As I said before, there are many definitions about what ASD is, or Autism Spectrum Disorder, is all about, as well as hearing all this terminology. It has been moved around from place to place, and sometimes it has been misinterpreted and misunderstood by some clinical specialists, but in all saying that though, though in recent times that it has been changed. So I thought to you all basically to share this, what ASD and autism is as well, because it needs to be a clearer understanding. There has been some misunderstandings, misgivings and whatnot, and there has been, you know, stereotyping kind of like behaviours amongst us, as well as many other, you know, mental health disorders that I have clearly shared with you all. So as I said, ASD and autism are both obviously a general term, which is a group of complex disorders that are characterized in varying degrees of characteristics such as difficulties in social interaction with their peers, non-verbal and verbal communication, and repetitive behavior. Bear in mind, as I said so many times before, if you've been watching from the very beginning, however, that I feel that every autistic is different on the autism scale, so they may show explicit signs of something that I've just shared, of these characteristic traits, be it, you know, some of them may be able to socialise, some may not be, just depending on their wiring of their brain and how they are in their way of living. Okay, as we know, ASD or Autism Spectrum Disorder can be associated with intellectual disabilities, however, which also entails difficulties in motor coordination, which is your movement and attention difficulties, along with some physical health issues that can attribute this, such as gastrointestinal problems or disturbances, as well as just, you know, maybe some sleep, so they may have some sleep problems. Just to bear in mind also though, like with this in mind, they do range from complex disorders also for this autism spectrum disorder that stems from the development of our brain especially.
So as you were basically, autism spectrum disorder, or ASD for short, is a developmental disorder that affects communication and behavior, right? Although autism can be diagnosed at any age, it's said to be a developmental disorder because symptoms generally appear in the first 2 years of life for a child. According to the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, that has been clearly introduced to people with the field of psychiatry versus everything else in 2013, of the new updated version of this manual has been created by the American Psychiatric Association to be used to diagnose mental disorders.
They have actually clearly stated that all autism disorders are now merged into the one diagnosis under the one umbrella for autism spectrum disorder, or ASD diagnosis. Also in this manual, however, they were recognised as distinct subtypes, basically, which includes autistic disorders, basically, such as your child's disintegrative disorder, pervasive developmental disorder not otherwise specified, or as it's abbreviated down to PPD, NOS, and Aspies. What has been known for this though, however, back in the day, you were either diagnosed as high functioning or low functioning autism, or another key word there is autistic. To me, it's kind of bizarre and strange all in one roll of emotion of how they basically, you know, do all these diagnoses. Some people that is on the spectrum disorder, be it whatever it may be, may take to an offence of certain terms that has been, you know, for them to be diagnosed, be it autistic, autism, the like and whatnot. But, you know, many people have their own likes to what they want to be called. Some want to be called autistics, some wants to be called auties, some just wants to be called, you know, for people with Aspies syndrome like me, as I said, abbreviate it down to, with Aspies syndrome, Aspie. There's no real key differences in and amongst it. It's just about people's preferences.
People with ASD have the following: difficulty with communication and interaction with other people, restricted interest and repetitive behaviours, symptoms that hurt the person's ability to function properly in school, work and other areas of life. Autism is also known as a spectrum disorder because there is a wide variation in type and severity of symptoms.
Aspies syndrome, however, is real and exists like many other mental health disorders. However, just to bear in mind, there are specific diagnoses that needs to be entailed with it all, as I said before, of what needs to be done. Obviously, basically, with Aspies syndrome or autism spectrum disorder, as well as autism alone, however, they do show, you know, children at the tender age of 3 to 4 years will tend to show signs of this. This is not common, however, for girls to have autism. It was briefly not thought to be as just an all guy kind of disorder, but now as it's coming into play after, you know, the 80s or 90s, as I shared briefly about the autistic spectrum for girls, and that I suggest to watch this, that it is now starting to become a bit more common for females to also actually get autism as well. I've also, like I said, just to hopefully somewhere up on the cards will show about the autism in girls kind of video somewhere in this video, hopefully, so that you can obviously get a clearer understanding about that. But I'm going to hopefully do a more updated version about the autism and females updates at all for you all. Anyway,
the American Academy of Pediatrics recommends that all children can be screened for autism. All caregivers should talk to their doctor about ASD screening or evaluation. The signs and symptoms of ASD to look out for. As we all know, people with ASD may have difficulty with social communication, interaction, restricted interest, and repeated behaviors. The list below that I'm about to share with you will give some clear examples of the types of behaviors that are seen in people diagnosed with ASD. Not all people with ASD, however, will show all these type behaviors, but most will show several. Social communication interaction behaviors may include making little or inconsistent eye contact, tending not to look at or listen to people, rarely sharing enjoyment of objects or activities by pointing or showing things to others, failing to or being slow to respond to someone calling their name or to other verbal attempts to gain attention, having difficulties with back and forth of conversations, often talking at length about a favorite subject without noticing that others aren't interested or without giving others a chance to respond, having facial expression, movements and gestures that don't match what is being said to you, having an unusual tone of voice that may sound sing-song or flat or robotic-like, having trouble understanding another person's point of view or being unable to predict or understand other people's actions. Restricted behavior or repetitive behaviors may include the following: repeating certain behaviors or having unusual behaviors, for example, repeating words or phrases, a behavior that is called echolalia, which I have clearly mentioned in one of my videos, what it is and what to look out for and so on and so forth in children, which I'll link in the description below, yes, to find out more if you want to watch it, or else hopefully I'll share it on this channel sometime soon of my podcast so you can gain a better understanding. Having a lasting intense interest in certain topics such as numbers, details or facts, having overlay focused interest such as with moving objects or parts of objects, getting upset by slight changes in a routine, getting more or less sensitive than other people to sensory input such as light, noise, clothing and or temperature, or even other key factors. People with ASD may also experience sleeping problems and irritability. Although people with ASD experience many challenges, they may also have many strengths, including being able to learn things in detail and remember information for long periods of time, being strong visual and auditory learners, excelling in math, science, music or art. Causes and risk factors to look out for people with ASD. We don't know of all the causes of ASD, however, we have learned that there are likely many causes for multiple types of ASD. There are many different factors that makes a child more likely to have an ASD, including environmental, biologic and genetic factors, as I clearly mentioned earlier about autism. Most scientists agree that genes are one of the many risk factors that can make a person more likely to develop ASD. So, however, the children who have a sibling with ASD are at a higher risk of also having ASD. Individuals with certain genetic or chromosomal conditions such as Fragile X syndrome or tuberous sclerosis can have a greater chance of having ASD. When taken during pregnancy, the prescription drugs valproic acid and thalidomide have been linked with a high risk of ASD. There is some evidence, however, that the critical period for developing ASD occurs before, during and immediately after birth. Children born to older parents are at risk for having ASD. ASD continues to be an important public health concern. Like the many families living with ASD, CDC wants to find out what causes the disorder. Understanding the factors that make a person more likely to develop ASD will help us to learn more about the causes. Currently, an organization called Centers for Disease Control and Prevention in the US is working on one of the largest US studies to date called the Study to Explore Early Development, or SEED for short. SEED is looking at many possible risk factors for ASD, including genetic, environmental, pregnancy and behavioral factors. While scientists don't know the exact causes of ASD, research has suggested that genes connect together with the influences from environment to affect developmental in ways that lead to ASD. Although scientists are still trying to understand why some people develop ASD and others don't, some risk factors may include having a sibling with ASD, having an older parent, having certain genetic conditions. People with conditions such as Down syndrome, Fragile X syndrome, and Rett syndrome more likely than others to have ASD. Very low birth weight. Diagnosing ASD. Doctors diagnose ASD by looking at a person's behavior and development. ASD can usually be reliably diagnosed by the age of 2. It's important to note, though, for those with concerns to seek out an assessment as soon as possible so that a diagnosis can be made and treatment can begin. Diagnosis in your young children is often a two-stage process. Stage 1, general developmental screening during wild child. Every child should receive wild child checkups with a pediatrician or an early childhood health care provider. The American Academy of Pediatrics recommends that all children be screened for developmental delays at their 9, 18, and 24 or 30-month wild child visits, and specifically for autism at their 18 and 24-month wild child visits. Additional screening might be needed if a child is at high risk of ASD or developmental problems. Those at high risk include children who have a family member with ASD, have some ASD behaviors, have older parents, have certain genetic conditions, or who were born at a very low birth weight. Parents' experiences and concerns are very important in the screening process for young children. Sometimes the doctor will ask parents questions about the child's behavior and combine those answers with information from the ASD screening tools and with his or her own observations of the child. Children who show developmental problems during the screening process will be referred for a second stage evaluation, which is the additional evaluation. Which basically, also in saying this, the second evaluation is with a team of doctors and other health team professionals who are experienced in diagnosing ASD. This team may include a developmental pediatrician, which is a doctor who is specialized in the training of child development, a child psychologist, and child psychiatrist, a doctor who has specialized training in brain development and behavior, a neuropsychologist is a doctor who focuses on evaluating, diagnosing, and treating neurological, medical, and neurodevelopmental disorders, a speech-language pathologist, a health professional who has special training in communication difficulties. The evaluation may assess the following: cognitive level or thinking skills, language abilities, age-appropriate skills needed to complete daily activities independently, such as eating, dressing, and toileting, because ASD is a complex disorder that sometimes occurs along with other illnesses or learning disorders. The comprehensive evaluation may include blood tests, hearing tests. The outcome of the evaluation will result in the formal diagnosis and recommendations for treatment. However, the diagnosis in older children and adolescents, ASD symptoms in older children and adolescents who attend school are often first recognized by parents and teachers and then evaluated by the school's special education team. The school's team may then perform an initial evaluation and then recommend those children visit their primary healthcare provider or doctors who specializes in ASD for additional testing. Parents may talk with those specialized about their child's social difficulties, including problems with social communication. These social communication issues may include problems understanding tone of voice, facial expressions, and body language. Older children and adolescents may have trouble understanding figures of speech, humor, or sarcasm. Parents may also find that their child have trouble forming relationships or friendships with their peers. Diagnosing in adults for ASD. Diagnosing ASD in adults is more often difficult than diagnosing ASD in children. And in adults, some ASD symptoms can overlap with symptoms of other mental health disorders such as anxiety or attention deficit hyperactivity disorder, ADHD. Adults who notice the signs and symptoms of ASD should talk with a doctor and ask for a referral for an ASD evaluation. While testing for ASD in adults is still being refined, adults can be referred to a neuropsychologist, a psychologist, or psychiatrist who has experience with ASD. The expert will ask about concerns such as the social interaction and communication challenges, sensory issues, repetitive behaviors, restrictive interests. Information about the adult developmental history will help in making accurate diagnosis, so an ASD evaluation may include talking with the parents or other family members. Getting a correct diagnosis of ASD as an adult can help a person understand past difficulties, identify his or her own strengths, and obtain the right kind of help. So it's now underway to determine the types of services and supports that are most helpful or improving the functioning and community integration of transition age youth and adults with ASD alone. Changes to the diagnosis of ASD. As I said before, or many times before, in the year of 2013, a revised version of the Diagnostic and Statistical Manual of Mental Disorders, or DSM, was released in the year worldwide. This revision changed the way how autism is classified and diagnosed. Using the previous version of the DSM, people could be diagnosed with one or several separate conditions such as I mentioned, autistic disorder, Aspie's syndrome, pervasive developmental disorder not otherwise specified, PPD, and OS. In the current revised version of the DSM or the DSM-5, these separate conditions have been combined into one diagnosis called the Autism Spectrum Disorder, which is used today. Using the DSM, for example, people who were previously diagnosed as having Aspie's syndrome would now be diagnosed as having Autism Spectrum Disorder. Although the official diagnosis of ASD has changed many times before, there's nothing wrong with continuing to use the term such as Aspie's syndrome to describe oneself or to identify themselves with a peer group. The treatments and therapies for ASD should begin as soon as possible after the diagnosis has been done. Early treatment for ASD is important as proper care can reduce individuals' difficulties while helping them learn how new skills and make the most of their strength. The wide range of issues facing people with ASD means that there is no single best treatment for ASD. Working closely with a doctor or healthcare professional is an important factor of finding the right treatment program. Medication A doctor may use any medication to treat some symptoms that are common with ASD with medication. If a person with ASD may have fewer problems with irritability, aggression, repetitive behaviors, hyperactivity, attention problems, anxiety and depression, behavioral, psychological, and educational therapy. People with ASD may be referred to doctors who specialize in providing behavioral, psychological, educational, or skill-building interventions. These programs are typically highly structured and intensive and may involve parents, siblings, and other family members to help with this to be of success. Programs may help with ASD, such as learning life skills necessary to live independently, reduce challenging behaviors, increase or build upon strengths, learn social communication and language skills. Other resources. There are many other social service programs out there and other resources that can help people with ASD. How few from some of these additional services. Contact your doctor, local health department, school, autism advocacy groups to learn about special programs or local resources. Find an autism support group. Sharing information and experiences can help individuals with ASD and or their caregivers learn about the treatment options and ASD related programs in the area where you're living. Record conversations and meetings with healthcare providers and teachers. This information may help when it comes to the time to make decisions about which programs might best fit for individuals' needs. Keep copies of the doctor's reports and evaluations. This information may help an individual qualify for special programs. Autism Spectrum Disorder is a developmental disorder that can cause significant social communication and behavioral challenges. There's often nothing about how with ASD looks that sets them apart from other people, but people with ASD may communicate, interact, behave, and learn in many different ways from most people. The learning, thinking, and problem-solving abilities of people with ASD can range from gifted to severely challenged. Some people with ASD need a lot of help in their daily lives, others may need less. A diagnosis of ASD now includes several conditions that used to be diagnosed separately, as I mentioned so many times before. The signs and symptoms. People with ASD may often have problems with social, emotional, and communication skills, might repeat certain behaviors, and might not want to change in their daily activities. Many people with ASD also have different ways of learning, paying attention, or reacting to certain things. Signs of ASD during early childhood and typically last throughout a person's life. The treatment, obviously, like always, there's currently no cure for ASD. However, research has shown that intervention treatments can improve a child's development. Early intervention services help children from birth to 3 years old, which is your 36 months, learn important skills. Service can include therapy to help the child talk, walk, and interact with others. Therefore, it's important to talk to your child's doctor as soon as possible if you think your child has ASD or other developmental problems. Even if your child has not been diagnosed with ASD, he or she may be eligible for early intervention treatment services. The Individuals with Disabilities Education Act, or IDEA, external icon says that children under the age of 3 years 36 months who are at risk of having developmental delays may be eligible for these type services. These services are provided through an early intervention system in your state of America. Obviously, through this system, you can ask for an evaluation. In addition, treatment for particular symptoms such as speech therapy for language delay often does not need to wait for a formal ASD diagnosis. Who is affected? ASD occurs in all racial, ethnic, and socioeconomic groups, but it's more about 5 times more common than in guys than in girls. For over a decade, CDC's Autism and Developmental Disorders Monitoring Network has been estimating the number of children with ASD in the United States alone. They have learned about how many US children have ASD. It will be important to use the same methods to track how the number of children with ASD is changing over time and also learn more about the disorder. If you're concerned, if you think your child has ASD or you think you could have a problem with the way they play, learn, speak, or act, contact your child's doctor and share your concerns to them. If you or the doctor is still concerned, ask the doctor for a referral to a specialist who can do a more in-depth evaluation of your child. Specialists who can do more in-depth evaluations make a diagnosis may include, as I mentioned, developmental pediatricians that obviously deals with special training, child development, and children with special needs. Child neurologists, doctors who work on the brain, spine, and nerves. Child psychologists or psychiatrists are the doctors who know about the human mind. At the same time, call your state's public early childhood system to request a free evaluation to find out if your child qualifies for intervention services. This is sometimes called a child find evaluation. You don't need to wait for a doctor's referral or medical diagnosis to make this call. Where to call for a free evaluation from the state will depend on your child's age. If your child is not yet 3 years old, contact your local early intervention system. You can find the right contact information for your state by calling the Early Childhood Technical Assistance Center or visit the ECTA website external icon. If your child is 3 years or older, contact your local public school system. Even if your child isn't yet old enough for kindergarten or around in a public school, call your local elementary school board of education and ask to speak with someone who can help with you to have your child evaluated. If you're not sure who to contact, call the Early Childhood Technical Assistance Center. Research shows that the early intervention service can greatly improve a child's development. In order to make sure your child reaches his or her full potential, it's very important to get help ASD as soon as possible. Also, where to find me? This again will be listed in the socials, but just to tell you right now is Facebook, Facebook is my Aspie.answers. My Twitter, again, will be Aspie Answers, which are both capital A. Spotify, obviously, is Aspie Answers, which is capital A, capital A. Patreon is my crowdfunding page right now. You can find me on patreon.com, Aspie Answers, basically. And for those of you who don't know what Patreon is, today, for those who are listening that are new, I have this set up for funding for future projects like this one of my podcast versus my merch that I've been designing, which I'll share more briefly soon about my merch update, or even in this podcast right now as I'm addressing this to you guys, is that it's like a crowdfunding page or funding page for creators like me, or content creators, music creators, whoever it may be that's seeking out funding to support themselves in a way of, maybe say they need extra equipment for their cameras versus maybe their radio equipment if they were doing something similar like I am doing today, or covering their rent, travel costs, what have you. And in saying this, also basically for the merch, you'll see me basically maybe wearing it once in a while on my YouTube channel, as well as maybe, you know, out and about in public. And so in saying this, my merch site is spreadshirt.com, like-of-n-aspie. And another one you can find me on my social is for those who haven't and I like to read instead of watching or what have you, as an alternative for you guys, is lifeofanaspieweb.wordpress.com. So this wraps up everything. I want to thank you all for listening right now. Follow me on the socials that were listed below. Subscribe, share this podcast to friends and family. You know, if you want to, feel free to become a Patreon to support this future project, as well as many others that is in the works as of this time. Feel free to, you know, donate big or small with me in this journey of it. And also my merch obviously will cover the cost for this as well. So I'll catch you all again on the other side. Aspie signing out for now, and bye.